to beyond our allotted time. So once it hits 5 o'clock, noon, everyone. My name is Janet Way, and I am the California ACC Women in Cardiology Section Chair. Thank you so much for joining us today for our program titled Catalysts of Empowerment, Women in Leadership. This program is being recorded, and you'll be able to review the video once it's posted on the California ACC website. We all know that California remains a specialty that's dominated by men, even though half of all medical students and about 40% of internal medicine residents are women. Only about 20% of cardiologists, 15% of the cardiology workforce are women. Despite this underrepresentation, women cardiologists are increasingly visible in leadership roles, from professional societies to research science, health systems administration, and clinical practice. So today we are just delighted to feature 4 amazing women cardiology leaders who are changing the field of cardiology by being catalysts for empowerment. Dr. Dipti Japoria, Dr. Rita Eng, Dr. Carol Watson, and Dr. Christine Albert. The mission of the Women in Cardiology section you can see is listed here. And there have been numerous efforts from the ACC and others to enhance the careers of women cardiologists and fellows and other CVT members, to encourage residents and medical students to pursue a career in cardiology, and to advocate for equity in salary and leadership advancement. So we are fortunate to work with our members from across California to advance this mission. Some of you may have recently attended UCSF's excellent annual Women in Cardiology Career Development event. And I am excited that we will be working together with UCSF, with Dr. Jaya Malati, to expand this annual event to target medical students and residents from all over California next year. We are also discussing mentorship programs within California ACC and perhaps creating a directory of women cardiology mentors. But we truly want to hear from all of you, all of our members, and how we can support you. So please contact myself. You can see my email on the bottom left, as well as our CEO, Leanna Collins, on the right bottom, to share any ideas that you may have how we can further our mission, or if you would like to volunteer for one of our future career development and mentorship events. We do try to cover different topics during our ACC events. Last year, we hosted a virtual event related to social media and digital presence, which included advice from 4 cardio Twitter superstars that you can see here. And if you are interested in learning more, the recording is still available on our California ACC website as well. We would also like to remind all of our fellows in training that the California ACC Fit section will be hosting 4 wonderful mentoring and networking meetings from November 2nd to 5th. All sessions are virtual and free, and each day will feature a different subspecialty. So I think that's a wonderful program that our Fit team is putting together, and more information can also be found on the California ACC website. Just also a reminder for our mid-career women, we are also proud to promote the ACC Sandra Lewis Cardiovascular Women's Leadership Institute, which is designed for cardiologists who are 12 to 21 years post-fellowship. Although this year's deadline has already passed, do look out for future emails about this tour program. In California, we are proud to have nearly 100 mid-career female FACC, and I think this is a great opportunity for those who might feel like they're kind of stuck in this broken rung here and not able to truly advance in leadership positions. So now I'd like to just introduce Dr. Jamal Rana, who is the California ACC chapter president, to say a few words before we get started with our program.
Hi, hello everyone. I just want to add that we are so fortunate to have Janet not only as our catalyst for women in cardiology, but she's also our treasurer. So she's part of our core team, along with amazing Ileana Collins, who is our CEO, and my awesome Southern California Governor, Anthony Hilliard. And as you know, that we're still in a very challenging time, but we did want to address this head on, and we came up with a new mission statement, which is for us to be the catalyst empowering members to transform cardiovascular care and improve heart health for Californians. And we are working very hard to do that, and today's session is a big part of it. I'm thrilled to have these amazing and inspiring women in cardiology leaders today. I have known their work firsthand, so I'm in complete awe. And I'm really hoping that lots of men are attending today's session because men in cardiology have a lot to learn from women in cardiology. So I'll hand it back to Janet.
Thank you so much, Mal. We really are so appreciative of you, Anthony, and Liana's support in our mission. And we'll now move on to why you're here to join us today to hear from these 4 inspirational women. They will each be giving us 15-minute presentations on their personal journey as leaders in their fields and what they've learned and how they can help us. So please submit your questions in the chat, but we will save all questions for the Q&A session to follow. So we will not do a question and answer period immediately after each session. Our first speaker is Dr. Dipti Ichaporia. I'm going to go ahead and ask Dr. Ichaporia to share her screen now. Dr. Dipti Ichaporia is the 70th president of the ACC and the college's 5th female president. She is an interventional cardiologist, is the Eric and Sheila Sampson Endowed Chair in Cardiovascular Health, Director of Disease Management for the Hoag Heart and Vascular Institute, and Associate Professor at the University of California, Irvine School of Medicine. Dr. Ichaporia has a long history of involvement and leadership in the ACC, including being a president of our California chapter. And so we are just so honored, Dr. Ichaporia, that you could join us today to speak on finding your strengths. Thank you.
Thank you so much, Janet, and thank you, Jamal and Liana. This is it's so wonderful to be back with all of my California colleagues. So I really appreciate the invitation. Jamal, thank you so much for your leadership, and you and Anthony have been doing a great job along with Liana. And then Janet, I see you really supporting the cause with women. And I love the fact that you hold the purse strings of the state as treasurer. They say who has the money has the power. So that's a good move on your part. So I was asked to talk about finding your strengths. And I spent some time thinking about, well, what does that mean? So I just need to, it's not wanting to go down. Let's see. Okay, so I thought about what is strength, right? And what is the benefit of knowing your strengths? And how do you find your strengths? I think those are all sort of important questions that I hope that we can try to answer. So this is a kaleidoscope of different strengths, right? Being meticulous, being adventurous, being passionate, clever, focused. When you look at strengths, what are your personal strengths? And how do we develop our strengths? And then are there different strengths that we need for different things? So are there different strengths you need for leadership roles, for work, for home? What are all of those different strengths? And I think it's sometimes worth thinking about that. We know for leadership that there's lots written on leadership strengths, and there are 4 large buckets. One is execution, right? Somebody that can execute, somebody that's responsible, can arrange things, can achieve things. Then there's the influence. You have to be able to influence when you're in leadership. So how do you communicate? How do you have self-assurance, create relevance, all of that? There's relationship building. There's a lot when you're a leader about relationship building. So that becomes important. And then can you think strategically? Are you analytic, or do you tend to get down to the weeds? So we know for leadership, there are strengths. But what about strengths in general? Well, we know that the father of strength psychology, and bet you didn't know that there is such a thing, right? But there is a whole subsection of psychology that looks at strength. And Donald Clifton was one early on in the 1960s, along with his colleagues at Gallup and from academia, began to study unique strengths of leaders. And he conducted more than 20,000 interviews, and he interviewed all different people from different sectors to look at their strengths. And they asked everybody the same question. And at the end, they really were not able to pinpoint exactly lists. And when they asked him about it, years later, he says, a leader needs to know his strengths as a carpenter knows his tools, or as a physician knows the instruments at her disposal. What great leaders have in common is that each truly knows his or her strengths and can call on the right strength at the right time. this explains why there's no definitive list of characteristics that describes all leaders. So Clifton went on with his team to create really a web-based program called Strength Finder. But I think one of the important things is it really gets down to the fact that you really need to know what your strengths are. And they may not be near like another leader that you may want to emulate, but you need to know your own strengths. So there are books, the Strength Finder, actually somebody gave me this as a gift many years ago. And you know, one of the things that you realize that there are many reasons why it's important to know about your strengths. In fact, you know, Clifton wasn't the only one. At the University of Florida in 2008, and Mr. Judge and his colleague Clarice Hurst, they also did a lot of work. And what they found was that if you're aware of your strength, you tend to have more self-confidence. And that translated into higher pay, higher happiness quotient, and in fact, better health, believe it or not. So there are many reasons that you should find strength. And if you find your strength, it can change your life. It can give you a sense of direction. It can improve your performance, help you achieve your goals, really give you that self-confidence, enhance some of your close relationships, even buffer you from stress. Imagine doing something that feels comfortable to you. You have less stress. It encourages you to grow more, and then generally creates a sense of happiness and fulfillment. And by the way, this is not all theoretical. There is data that goes behind this. So we know that there are reasons to find strengths. Mahatma Gandhi said, strength does not come from winning. Your struggle develops your strength. When you go through hardships and decide not to surrender, that is strength. So I would say to you that one of my favorite things to say is that it's not about the destination, but it's the journey. And so I think that's a really important point. Why? Because a journey is what helps you to understand what your strengths and weaknesses are. And I really believe that in your life, when you start off, it's like a blank canvas, and everything that you do is a dot on this blank canvas. And as you go through, there comes a time when you can turn around and look at that blank canvas with those dots, and those dots will have connected in ways that you did not anticipate. So I think that's part of the journey. And I really do think there are no places worth, there are no shortcuts to any place that you want to go. And you don't want that shortcut, because that road is what teaches you what your strengths and weaknesses are. So the steps in my journey was that I trained at Stanford, did my internal medicine residency. And then from there, I went on to UCSF for and I was on faculty in general medicine. And it was during that time that I decided that I wanted to do cardiology, and then went on to Georgetown under Bernie Gersh and did my general cardiology, and then came back to Stanford and did my interventional cardiology. All of those things define who I am today and have helped me to find some of my strengths and weaknesses. So Vincent van Gogh said, what would life be like if we had no courage to attempt anything? Well, I will tell you that there were many times that I was afraid about some of the things that I did, but I did them. As an interventionalist, the first time I did a robotic PCI, that was tough. And being at Hoag Hospital, they didn't have endowed chairs, and I had an endowed chair, and I had to define what that meant. But then interestingly, somebody approached me and said, we'd like to do an endowed chair for you. And I said, well, I have one. And it took me almost about a year, but I sort of started thinking why I have evolved in my career and in my thinking. It's okay to give up one endowed chair and go to another. But that decision took me a whole year. And it was one of the best things I did. So, when it says courage doesn't mean that you don't get afraid. Courage means that you just don't let your fear stop you. So when I became chair of board of governors, I'll tell you when I went to convocation years ago, I went all alone. And if you've been to convocation, people bring people to take pictures. I went all by myself, and I thought, oh my gosh, I didn't know people brought people. You bring friends, people to take pictures. I had nobody. But what I remember so clearly is this person with the mace. And I sat there and I watched this person, and I thought to myself, I wonder how they get that job, not ever thinking that was going to be my job. So the journey sort of brings you that, and learning along the way. And then that helps you to lead, led me to this journey. And, having that moment, even though it wasn't on stage, I think all of that prepared me for when I took over as being president. So T.S. Eliot said, only those who will risk going too far can possibly find out how far one can really go. So some of the things that I think are important in that journey to find your strengths is, in general, I think being a lifelong learner, which is something that I think I am. I'm very inquisitive. I want to know. When I was at high school, I was a reporter for my high school paper. I went on to write for my college paper. So I have an inquisitive nature. So I think that wanting to learn is something. And then I think it's really important to develop expertise. As you do that, you learn about the things you like, the things that you don't like, the things you feel comfortable with. And, I do think what Nelson Mandela said is true. Education is the most powerful weapon which you can use to change the world. And the beautiful thing about learning is that no one can take that away from you. And I think that's true. So I think that an important piece in the journey is to become a lifelong learner, develop some expertise, be inquisitive. And it was my inquisitive nature that actually came up with the idea of being coffee with the ACC president. Why? Because, well, I like talking to people. I want to know why they went on the journey they did. And if one of the things that's the most important is sitting there and having casual conversation with coffee and finding out why they did it, I find it fascinating. I could probably talk to most of these guests for a lot longer than I have time for, but it's certainly something that led me to that. I think building relationships, I said early on, I think the relationships, when you think in medicine, relationships are important with your patients, they're important with the nurses, your colleagues. Team-based care is really here so that you realize how important it is. But, mentoring, whether you're a mentee or mentor, I think all of those relationships are important because I think whether you mentor somebody, you learn when you're a mentee or a recipient of some of that. But I think that, friends, mentors, they help you, they support you, they give you advice, they give you guidance. I think that's really important. And then I think, do you have the ability to inspire others to collaborate and take action? When you're in groups of people, that's what you find out. And then people follow a talented leader. They want to be inspired and motivated. So you learn those things as you interact. And then I think learning and networking with others and develop an amazing network of impressive peers who one day will become your network of powerful leaders, which is which has been sort of my journey. I have a great number of peers that are powerful leaders. And then, of course, I'm going to show you a series of photographs because this has been my journey of all these incredible friends. You'll see Carol Watson is there, Beacon Bosker, Liana Collins when I was president, along with George Smith, Kathy Gates, who's now our president, Roxana Marin when she and I went to Jeddah, so people that I've known along the way and the journey that I've had. These people have helped me to see what my strengths were, some of my weaknesses, because they're not afraid to tell you about that. These are my 3 closest male friends. My friend John, who was with me in the Middle East. In the middle is Craig Jorgens, my friend that I trained with doing interventional cardiology, who lives in Australia, who is the Aussie colleague. And then my friend Thad Waits, who's from Hattiesburg, Mississippi. And then, of course, my extended ACC family, who always teaches me lessons. This is from Legislative Conference a couple of years ago. And then, of course, my present ACC Board of Trustees family. And then don't forget your own personal family, my sister, and then my parents. They're ones that are not afraid to tell me, hey, cut it out, knock it off. All of the things that sometimes you just need to hear. And then, of course, my spouse, who is, I think everybody, whether, a significant other, spouse, I think they're very important because they're the ones that really will tell you exactly. And they're your support system. So I think it's important to build those relationships. I think the other thing is learning to say yes. I've said this before. I think it is important to say yes. Early in my career, I learned to say yes. And I said yes till I earned the right to say no. And I think that's important. And I think that getting involved, learning what motivates you, where your passion lies, happens by saying yes. There were things I said yes to that I would never say yes to again. But I'm glad I did because I learned something along the way. And then when you do get asked to do something, don't just meet expectations, exceed them. It teaches you about time management. It teaches you about tenacity, all of those things. And if you start to have a strong track record of performance over several years, that then takes you far. And so I think that, Steve Jobs said the only way to do great work is to love what you do. How are you going to find out what you love to do till you do it? And then I would say nothing in life is wasted. So all that yes translates into experiences that are rich for your life. I think the other smart is emotional intelligence. Plato said 2,000 years ago, all learning has an emotional base. Aristotle's challenge was anyone can become angry. That's easy. But to be angry with the right person to the right degree at the right time for the right purpose and in the right way, that's not so easy. And so I think that to be boldly self-aware is the other piece that I would say in terms of finding strength. You know, we're being judged by a new yardstick, not just by how smart we are, but by our training or expertise, but how we handle ourselves and each other. And so, you know, Daniel Goleman, I love this book. He says, I found, however, that the most effective leaders are alike in one crucial way. They have a high degree of what has come to be known as emotional intelligence. And he said, it's not the IQ or technical skills that are irrelevant. They do matter, but mainly these are threshold capabilities, entry-level requirements. And so I think that's important. So I think being boldly self-aware, you know, I think that it's important. It's not emotional intelligence isn't about being touchy-feely, but being emotional. It's the ability to recognize and manage emotions in yourself and others to reach the desired outcome. I think it's also important to give yourself time to find your strength. So that means striving for that work-life balance in the best way that you can. And it can be that when you're at a meeting, I was in San Francisco for a meeting and I went for a walk. It could be going for a massage when you're at a scientific session and sneaking away for an hour or meeting somebody for a drink. But I think all of those things are important. Give yourself time to find your strengths. I mean, I have two last slides. The first the 5 W's of life. Who you are is what makes you special. Don't change it for anyone. What lies ahead will always be a mystery. Don't be afraid to explore. When life pushes you over, you can push back harder. Where there are choices to make the one that you won't regret. Why things happen will never be certain, but take it in stride and move forward and have optimism. And then I'm going to leave you with this unknown monk. When I was a young woman, I wanted to change the world. I found it difficult to change the world, so I tried to change my nation. When I found I couldn't change the nation, I began to focus on my town. I couldn't change the town, and as an older woman, I tried to change my family. Now, as an older woman, I realized the only thing I can change is myself. And suddenly I realized that if long ago I had changed myself, I could have made an impact on my family. My family and I could have made an impact on our town. Their impact could indeed have changed the nation, and I could indeed have changed the world. And I think that's what finding your strength is the ability to be able to change the world with your strength. So I'm going to stop here. And since I didn't have my moment on stage, I'm having my moment on Times Square. So thank you very much for your attention.
Wow, thank you so much, Dr. Tapur. That was just amazing. Taking us through how we recognize our strengths, your key strengths that you find are important for being a leader. I want to remind our audience to type in their questions in the Q&A section, and we'll save them towards the end. Again, wonderful presentation. Again, we'll save some questions for you. At this time, I'm going to go ahead and share my screen and introduce our next speaker, Dr. Rita Eng. Dr. Rita Eng is the physician-in-chief of the Kaiser Permanente East Bay. She is a non-invasive and preventive cardiologist and is passionate about global health care equity in third world countries. She was my chief cardiology fellow when I was a first-year fellow at Cedars-Sinai and a role model to me and many young women across the country. Some of you may actually know her as Miss California 2000. I'm just so delighted to welcome Dr. Eng to speak on leading during times of crisis, courage, compassion, and resilience during the pandemic. Thank you so much, Rita.
Janet, it's such a privilege to be here among these esteemed panelists, and I'm excited to have a chance to chat together with this incredible group of leaders. And when I say leaders, I mean all of us here on this call. So next slide, please. I wanted to start the talk by sharing a photo of my day last Friday. And I had the privilege of having lunch with two of my trailblazing inspirations, or I call them luminaries. And on the right is somebody that you all probably know very well, is Dr. Nora Goldschlager. And she was actually attending my very last rotation of intern year at UCSF. I'd saved it for my last rotation because I was so terrified of cardiology. And it was Nora who helped me see the light and helped me realize that this was my calling in life. And she helped me get over all those insecurities I had about entering a male-dominated field, about having a life and having a family, and being able to do something that I truly loved the rest of my life. And then when I started at Kaiser Permanente in the Permanente Medical Group, Dr. Ellen Killebrew was my office mate. And come to find that actually Ellen and Nora are the best of friends and actually did fellowship together. So next slide, please. Which led to one of my first lessons that I want to talk about is being an ally and sponsor for the next generation, because it is a very small world. And on the left-hand side of the screen here, you can see a picture of Ellen in her training, and she's conspicuous as the only female in her training class. And to the right is actually a photo of my fellowship class. And you talk again about a small world. I see Dr. Rana there, I see Dr. Wei there, and many of the people that are actually on this call who were an instrumental part of my training. So thank you. And just as Dipti said, continue to make those networks and connections and be the change that you want to see by influencing those who are alongside you. Next slide. So I joined the Permanente Medical Group straight out of training. And if you had told me 20 years ago when I was in the middle of the training that I would be a healthcare executive overseeing more than 900 physicians and thousands of staff and spanning, all the way from the point of Richmond through Oakland down to Alameda with 2 large hospitals with tertiary care centers, as well as 5 medical office buildings, I would have said you're crazy. And yet, stepping back a bit, the Permanente Medical Group, which is the largest multi-specialty medical group in the nation, we were really born during times of crisis. So next slide. Right now in our service area, we care for more than 450,000 lives, and across Northern California, more than 4.5 million patients. And our medical model was born during World War II. Next slide. And it really was during World War II that the shipyards offered really this unprecedented opportunity for women and people of color to learn skills and enter the industrial workforce. So next slide. And so when the cruise ships docked in my very own backyard, where I could see the ships from standing on the 11th floor of our hospital building, it came as no surprise that we were poised and ready because we in medical care, we're all leaders. And actually at times of crisis, whether it be a code in the middle of the night or a global pandemic, this is what we were trained for. So next slide. I'm not going to tell or regale you with stories about kind of some of the processes that we had to go through, because I think this is what we all did across the entire United States. This is actually a photo of our ICU where we tripled our ICU bed capacity across campuses. We more than quadrupled our overall hospital beds. We fielded millions of staff messages and messages from patients who were nervous, anxious, worried, sick. Next slide. We quickly stood up lots of new processes, including testing, COVID swabbing that had never been done before in outpatient settings. Next slide. We continued with our tertiary care center and also our strong commitment to teaching. We have multiple residencies as well as fellowships for our young learners and keeping everybody safe through all this. Next slide. And everybody and our patients continue to have normal life events, including all the celebratory things that that makes us human, including birthdays, anniversaries, and babies. Next slide. And for my family and I was one of those who was actually cared for by our incredible teams here. So this was at the height of the first surge. I was very pregnant. I couldn't see my toes, getting the hospital center ready, and then went out and had little Leo in April. And he's now 1.5 years old, believe it or not. And some people had pandemic puppies. I had a pandemic baby. He's been just such a little light, and came back several weeks later and helped to, again, jumped right back in terms of running our command center and our hospital response for our millions of members across Northern California. Next slide. And so I wanted to just start by talking about some of our experiences here. And I wanted to read to you one of the passages of, we started nightly town halls here across the entire East Bay to really bring together everybody during a time that was very scary. And if you recall, this was when California was surging, our hospitals were surging, and people were scared. And so this was something that we did to bring people together. And every night we'd get on kind of the old radio, except it was all virtual and through the telephone lines to share some of our thinking. So the tempest of the past year has tested us like never before. The seasons are changing and the days are now short. We leave our families and little ones in the darkness of dawn to join our brothers and sisters here in the quiet halls of our clinics and hospitals, caring for our patients who have entrusted us with their lives. And we often travel home with the chill of the evening's frost, well after the sun has gone down. I know we are weary. This historic epic has brought upon us an emotional and physical awakening that has shaken us deeply to our core. We could have never imagined the harrowing chapters when the new year first rang its bell. We now brace together for the long winter that has come. In storms such as this, it would be easy to retreat, to allow our fears to overtake our consciousness, to lay blame onto others, or to deny the reality of this pandemic that has ravaged our globe, or to simply wish that someone else would come along and the winds would carry away the heavy burden of this invisible virus in our midst. Some have chosen this path of temporary mental retreat, but not us. In this year of sheltering in place between distance learning Zoom lessons, between home-cooked meals and endless toddler battles over bedtime, Logan, Lucas, and Leo have made it their life's mission to turn their mother into a superhero aficionado. So during this heavy moment, when every weather bell and every data point across the globe is surging, when it seems that we are on the precipice of humanity's very existence, I can't help but be reminded of one of Spidey's most famous mantras that so aptly describes our roles as physicians today. With great power comes great responsibility. So with conviction and might, my dear friends and my colleagues in arms, we will forge bravely onwards until we are victorious. We were born for this, we were trained for this, and this is our time. Next slide. And so I wanted to share with you some of the lessons that I personally learned during these last very long 2 years. Lessons of courage, compassion, and resilience that I've seen in our people, that I've seen in our colleagues, and that I've seen in our families and from our patients. Next slide. And this isn't just with COVID. We all know that there has been a lot going on, whether it be the climate change, whether it be the fires, the power outages, the important conversations about equity and health equity and our role as healers in this environment. Next slide. So I wanted to start with courage. We all know that the mission is critical, and yet I think one of the biggest lessons as leaders that we all quickly learn is that good leaders always understand that the greatest and most valuable resource is actually our people. And so in a really volatile environment, communicating your mission and your guiding principles clearly to your people becomes quite paramount. And so early on in the pandemic, I started saying very vocally and out loud my mantras. And so these were my first mantras that I talked about in one of my first town halls. Is number one, that my number one priority is the safety of our people and our patients from every aspect, whether it be our physical safety, our emotional safety, or our financial safety. Secondly, in a time when not a lot was known about the virus, about transmission, about how to treat it, safety protocols, we knew as healthcare providers and healers that science would guide our decisions and actions. And finally, stating very clearly to my people that they would have always a firm commitment for me that I would communicate openly and be transparent with my thinking, even when it was not popular or easy or that the path was not clear. Next slide. And so demonstrating strong leadership through visible actions and behaviors is something that I think all of us do in different ways. And it's important that we continue to do this, particularly in times of crisis. Setting aggressive but attainable goals, you can never over-communicate in all forms, whether it be in social media, in person, in smaller groups, in larger groups. Really listening and encouraging divergent opinions in all forms and understanding challenges at all levels. Investing the time to really get to know your people and earning the trust of your people and having them share an understanding of larger interdependencies, being visible and in it with your teams. This is a picture on the right-hand side of me. I continue to take call, I continue to see patients in clinic, I continue to round in the CCU. And finally, knowing the operations inside and out. As a leader, your decisions have consequences, and know that sometimes those decisions are not always popular or the obvious decisions. Next slide. I think that one of the next lessons that I learned is compassion. In a time that can sometimes feel very dark, leaders are often the ones that provide a lot of light. And so here's some photos of my journey through the pandemic, and I'm purposely showing you some photos of my home, whether with the new baby and all of us trying to work virtually or late into the evening, taking calls with little Leo and my little baby carrier. And this is me failing miserably, trying to teach social distance learning at home to a kindergartner. So everyone really is going through something, and burnout is very real. In fact, getting help is a sign of strength and not weakness. That there are a lot of very strong, efficient, organized people and actually a lot of pain right now, especially with this prolonged pandemic. And finally, it's really not about good people not working hard enough. Next slide. Helping to identify and clearly state what the actual problem is. The problem is not our people. The problem is that despite increased supply and everyone working harder than we've ever worked before, that the American healthcare system simply was not designed to keep up with this extraordinary demand for this extended period of time. And just as the deep supply demand mismatch is a global problem spanning innumerable number of industries and not just confined to healthcare. Next slide. And so just to give you another little snapshot, I know I'm many years out of training and I'm an attending and I'm an executive. This was actually my home after a call weekend on cardiology. And I came home to this. Yes, I'm a boy mom. And this 2020 truly was a year of the fourth. My home often feels like a toddler frat house. Next slide. I give myself another decade to have a grown-up home. So leading during times of crisis. In these times, it can be very difficult. And let me just say, know that the imaging isn't coming across. And so I'll just kind of talk a little bit about this, that everyone is really going through something. I state very clearly that burnout is real and that I care deeply about you and I see you and I hear you. We're often hardest on ourselves as healthcare providers. Today, your good is good enough. In fact, it's not just good enough, it's more than enough. Choose grace towards yourself and others who may be hurting in ways you may not see on the surface or in that moment, and really be exquisitely mindful of the things that you're putting out into the universe, whether it's on social media or in communications or in the hallway, being a part of the solution and not making any assumptions about others and really having a curiosity to ask what's going on. Next slide. And so leading during times of crisis finally requires a lot of resilience, particularly as we're 20 months on and going. And we know that in doing so, it's been a long, hard season. We've all been through a lot and we're simply not done. I tell others, and I've said very vocally and loudly, that this pandemic will end. This is not going to be forever. The current calamity is a result of a novel coronavirus meeting naive immune systems. And when enough people have gained some immunity through either vaccination or infection, preferably vaccination, the coronavirus will transition to what epidemiologists call endemic. It won't be eliminated, but it will not upend our lives anymore as it currently is. Helping people to see that there is a path towards the future. Secondly, the coronavirus simply does not play fair. It's going to keep changing its rules on us. And as a leader for all of us in healthcare, to know that the rules of engagement keep changing from variables that are outside of our control. And when that happens, I blame the virus. I don't blame my teammates. And finally, we really do have to take care of one another because we are stronger together. Next slide. And so I wanted to share some of my own personal silver linings during this really hard time, and we all have them. For me with a new baby, lactation times look very different this year. I've had the opportunity to do some virtual clinics from home and actually have little Leo cuddled up right next to me in the couple minutes that I can sneak away. I've forged strong relationships and deep bonds of trust with my colleagues. We graduated from kindergarten, never thought it was going to happen, but it did. And now all the kids are back in school. And my little guys, who I never was able to find enough time to actually ship over to swim lessons, we actually taught them how to swim and actually how to surf during the pandemic because we were able to go to Grandma and Grandpa's house every weekend. Next slide. And so every cardiologist, what's a cardiology talk without some EKGs? So this was some EKGs that I shared at one of our town halls recently. And it was an 82-year-old female that I saw on call with hypertension, presented with dizziness. And so my question for the group of many non-cardiologists was, what is this rhythm? So next slide. And about 5 minutes later, she kept cycling in and out of this rhythm. And so it made the answer a lot easier because the ED was calling me about VT. But next slide. But made it much more apparent as we got more data and learned a little bit more that it was much more likely to be an SVT. And next slide. Aside from showing you some fun EKGs, the real reason I wanted to tell you about this was about the actual patient. I think when I did a follow-up visit with her, she heard something in my voice. I think it actually was the day that I sent the kids off to start up school again. And she asked, how are your boys doing amidst all this chaos? And I think she could hear some of that stress. And she said, I want to tell you a little bit of the story of me growing up. She had actually grown up during World War II, and she was orphaned because of the prolonged bombings that had happened in Britain. And as a result, she was sent to an orphanage in Wales, where to a lovely home where she started school. And she said in their classrooms, they didn't categorize people by ages. Many of her classmates there were from a full range of ages. And because the war had gone on for so long, many people had lost limbs and such, and many were in varying degrees of being able to read and write. They were put into different color groups. And she was like, I didn't know if I was delinquent or if I was a superstar. All I knew was that I was in the right place and at the right time. And you know what? By the end of the year, we were all just fine. And so her lesson to me, and something that I remember always, is that we're all in the right place and the right time, and we're all going to be okay. So next slide. I just wanted to really thank all of you for all of your leadership over the last 20 months. It has been a historic time, and we in healthcare, this is a calling. And so our leadership, we've not only helped to save millions of lives across the country and globe, we've helped to secure the safety of your friends, your families, and your patients. And for that, I'm so grateful to be here in this esteemed role as a cardiologist and together with all of you. And one last reminder, please remember to take care of yourself. Thank you, everybody.
Wow, thank you so much, Dr. Eng, for sharing just how you led an entire organization through the pandemic, highlighting key qualities that you truly embody of how you became a superhero for your colleagues, your community, and your patients. Thank you again. Please go ahead and enter your questions that you have for Dr. Eng. We'll go ahead and save those for the end, and we'll go on to our next speaker, Dr. Carol Watson. Dr. Watson is the director of the UCLA Cardiology Fellowship Program, the director of the UCLA Women's Cardiovascular Health Center, and the UCLA Barbara Streisand Women's Heart Health Program, co-director of the UCLA Program in Preventive Cardiology, and professor of medicine and cardiology at the David Geffen School of Medicine. Dr. Watson has a PhD in physiology, has been a principal investigator for several large National Institute of Health studies, and was a co-author of the 2013 ACCHA cholesterol guidelines. She is beloved by her trainees, and we are just so honored for Dr. Watson to join us today and speak on fostering the future of cardiology. Thank you, Dr. Watson.
Thank you so much for bringing us all together today. I'm seeing all of my friends, and that's the beginning of fostering the future, getting us together and sharing our experiences. Next slide, please. There's a thing called imposter syndrome where I think a lot of we females have it. I'm still not sure I got it right half the time, but I want us all to remember we are here, just as Rita said, we're in the right place at the right time for the right reason. We all earned this. And I want to show you a little bit of data that really shows how important female physicians and cardiologists are. So this is some data looking at survival of patients post-myocardial infarction based on patient-physician gender concordance. So it turns out that female patients who had an MI who were treated by a female physician had higher survival rates. That's the blue line on top. That's more so than if the female physicians were treated by male physicians. That's the red line below. But male physicians who had more exposure to female physicians actually had better outcomes. So their outcomes looked more like female physicians who took care of female patients. This is one study, and there are other studies that I'm sure show different things, but I want to make it clear. You are at the right place at the right time, and you need to be a part of this medical system because you elevate the care around you. Next slide. This is another study. This is from over 1 million more readmissions for patients with a myocardial infarction. They looked at mortality rates, 30-day mortality and 30-day readmission rates. And what did it look like? Females and males in general had excellent mortality rates, but the females, the dark green bars, had slightly but significant reduction in mortality rates and readmission rates. Next slide. And this is another small study, but it was looking at ER visits. They asked patients immediately after their visit what their satisfaction was, 1 to 5 scale, 5 being the highest. Female physicians were tended to be rated higher. As you see, the mean score is 4.765. For men, there was still a lot of satisfaction, but the mean score was a little lower at 4.462. Next slide. So we don't know all the reasons, but everyone will understand, I think, that men and women communicate differently. And they've shown studies where women spend a little bit longer talking to patients. They spend a little more time in between asking a question before jumping in. And I think the difference is in how we interact are our strength. There are people who will make you think it's part of your weakness, but it's not. My passion is mentoring young people, men, women, anyone, and running the fellowship. We now have a whole cadre of young women, and I can tell you, imposter syndrome is rampant. I have it, we all get it sometimes, but I want us all to know how we can foster the future is convincing our younger colleagues how important they are. Next slide. So we need female cardiologists. No question, full stop, I will die on that hill. Next slide. But when you look at some of the indicators, people tend to pay for what they value. So salaries, for instance, I would like to say that physicians' salaries are equivalent work, get to the same amount of money, but we've seen many times that that's not the case. So when I want to get us all to think about in terms of fostering the future is getting involved with advocacy. We have to, and Jamal will tell you how important this is, because we have a political action committee that works on these things. This is looking at physician salary in different hospitals. Each tick line on the x-axis is a different hospital, and the dark green circles are salaries for men. The lighter green circles are salaries for women. If you look at the yellow bars in the bottom, that's the difference between men and women. So the first 4 hospitals to the left, the women seem to make more than the men. That's excellent. So you see, it's not excellent. We should all be paid the same for the same work. But you see the rest of the dots over to the right. Men make more than women. If you can tick one more time. On average, female physicians make about $20,000 less per year than male physicians. And that's exacerbated in some specialties, including cardiology. We have to realize that the worth of a physician and clinician should be compensated appropriately, and it should not matter what your gender, race, religion, sexual orientation, or anything is, and that we need to advocate for. And yes, I will die on that hill too. Next slide. So if you want to foster the future, we all have to advocate for pay, fairness in pay. Pay us fairly for the work we do. Next slide. Okay, I'm in academic medicine, and promotion is the epitome of value. So you are promoted if you're valued. This is a slide. Each of the red lines is a different health system, and the x-axis shows the ratio of male full professors to female full professors. I'm sorry, female full professors to male full professors. So if you see -5, that means there are 5 times more male full professors than female full professors. -4 means there's 4 times more. And so you can see for each of these red lines, there's more male full professors than female full professors. You go to the right, which is -1. If it was there, that would mean there was equivalent numbers, but there's no lines there that are at the 1. So all of these, give me tick one more time. Female physicians are less likely to be promoted, and that we've seen time and time again. And that's when you control for publications, grant funding, experience, everything that we've seen. So next slide. To foster the future, we have to advocate for fairness in academic structure and promotion. Next slide. This was an interesting study, which I never really thought much about, but the more I thought about it and started paying attention, the more I saw it. This is looking at this. Investigators went to a bunch of medical conferences and just took a bunch of videos of different talks, and they saw how the speaker was introduced. They looked at 781 videos, and if a female speaker was introduced by a male, they were less likely to be introduced with their professional title. So they became Mary or Rita or any of us on here instead of Dr. Eng or Dr. Ajapuria, etc. If you look over there to the right, males, they were pretty much equally as likely to be announced by their professional designation, whether they were introduced by males or females. But women were much less likely to be introduced by their professional titles if they were introduced by a male, that's the red line at the bottom, than if they were introduced by a woman, that female, that's the blue line up top. Next slide. So we need to advocate for our colleagues, our friends, our everything to see us. So sometimes a first name basis is appropriate and is a sign of familiarity and of friendship, but sometimes in a professional circumstance, a professional designation is what we need. We need you to see us. Next slide. Now, when we've looked at, again, I'm in academia, and grant funding is another very important metric. If you look at comparison of NIH grant amounts to first-time male and female investigators, male investigators are on average awarded $41,000 more than female investigators. And if you look at certain high-profile institutions, they specifically looked at Big 10 institutions here, the difference was even greater. Males were awarded about $82,000 more than females. And again, no difference in publications, citations, research areas, etc. So next slide. So you need to support us. We need to advocate for that over and over and over again. Next slide. So female physicians, better satisfaction, at least as good, better outcomes. Next, fewer promotions, lower pay, and less support. And then it doesn't surprise you that there are only about 15% of cardiologists that are women. We need to fix this. Next slide. So to foster the future, advocacy, we all have to get involved. And California ACC has excellent opportunities to do that. You need to pay us. We have to advocate for transparency in pay and fairness in pay. You have to promote us when it's appropriate. You have to see us and, see us for our full worth and support us. Next slide. One of the things that the ACC does so well is to get strong female mentors out there in front of everyone. This is a panel I participated in with Michelle O'Donoghue, Roxana Moran, Tracy Wang. They are all very senior, accomplished female cardiologists. We had a younger cardiologist, Salma Mohammed, who was on the panel with us as well, because that is what fostering the future means. You don't walk into any room or any important place without grabbing someone's hand and taking them with you. We took Salma with us, and she's doing great. Next slide. The other thing that's really important about how we can foster our younger colleagues is to see them, all of them. I love seeing Rita's kids. I love seeing my trainees' kids. I love hearing dogs barking in the back of a Zoom. You might hear mine soon. This is an example of our first-year fellows joining each other at the beach just to with their kids and their families. So we see all of them. That's what makes us great, is each and every part of our lives, not just our professional lives. Next slide. And we've had a women in cardiology section that we started at UCLA about 3 years ago. This is one of our first meetings before pandemic, where we all met together in a small conference room. And we have a couple of males who join us in solidarity every time as well. Next slide. This was our most recent women in cardiology meeting, which was just last night. Again, because of the pandemic, we were not together. It was via Zoom. But we had medical students, residents, fellows. We had Mary Branch, who's down there, left lower column. She's a cardiologist in training in the Midwest. She just joined us on virtual Zoom because we invited her. And that's when we get to really foster the future. They hear about life, the benefits, the harms, the real times, the bad times. And one of the things that is most important, they see us, all of us, our families, our kids, our dogs, our professional lives, our interventionalists, our electrophysiologists, everything. That's how we foster the future. Next slide. So we have to rethink how we do this, because if we keep doing what we've always done, we're just going to keep getting what we've always gotten, and that's 15% female cardiologists. We have to do better. Thank you so much for this very important conference. It's really great that we're all here together.
Thank you so much, Dr. Watson. That was just truly wonderful. And I think it's going to be very fruitful discussion for our panelists. Again, please put your questions in for Dr. Watson. We will review that during the Q&A. Our next speaker is Dr. Christine Albert. Dr. Albert is the founding chair of the Department of Cardiology at the Cedars-Sinai Smith Heart Institute, the immediate past president of the Heart Rhythm Society, the Lee and Harold Kaplowitz Distinguished Chair and Professor of Cardiology. She is a cardiac electrophysiologist and epidemiologist with an MPH in clinical effectiveness, and the principal investigator for multiple large NIH studies. Her most recent R01 examines the impact of omega-3 fatty acids on primary prevention of AFib and sudden cardiac death. We are so excited to welcome Dr. Albert to speak on inspiring innovation. Thank you, Dr. Albert.
Thank you, Janet. And I'm so proud to see you leading the California chapter of ACC, as others have said. So, you know, this is really great to just hear everyone's stories. And I always learn so much when asked to do these things. And so I was asked to talk about inspiring innovation and also to kind of give my journey. So I thought I would try to weave the two together. And the first thing I had to think about is, what is innovation? What do we mean? And in general, innovation can mean a lot of different things, but I think the core of it is doing something new, developing a new idea, maybe adapting to a situation in a new way. You know, there's all kinds of ways that you can think of innovation. And so when I thought about it that way, I thought, well, there has been a lot of innovation in my career. And so I tried to think of the things that fostered innovation early on for some of you who are, you know, early on in your training. And then for those of you who are further along, things have fostered innovation later on. So just from my background, I grew up in a town called Methuen. Nobody knows where that is, you know, usually when I tell people, but it's a huge part of who I am. And this is where it is. It's in Massachusetts. It's up here right on the border of New Hampshire. And it's a blue collar town, very, very different. And even though it's close to Boston, it's extremely far away in socioeconomic status and just kind of outlook and things like that. So I wanted to innovate when I was younger and get away. So I went to Boston University. And so even though that was just in Boston, that was very different. And I did well enough at Boston University that I was able to get into Harvard Medical School. So it was a big journey going from Methuen to Harvard Medical School. And I would say that during that time, I learned a lot about myself personally, and there were a lot of changes that occurred in me as a person to become a doctor. And it was really a growing experience. But I think that what this did for me was, really say, okay, I could do pretty much anything. I might have a few eyebrows raised when I do it, but if I want to do it, I can do it. And I think all of us can do that. And I think that that was an important part of that experience. Then I did my training at Mass General Hospital, cardiology, EP, residency cardiology and EP training. And then I really loved electrophysiology, but then I decided again to do something a little different. I decided to go to the Harvard School of Public Health to get a clinical effectiveness, primarily because one, I had gotten bitten by the research bug a little bit as a fellow, but also because I wasn't entirely sure that some of the procedures that were happening in EP at that time were going to actually work, like ICDs. That could tell you how old I am. And then the studies came out that really showed that they were beneficial while I was at Harvard School of Public Health, which was great because then I went back and finished my EP fellowship at Massachusetts General Hospital. And I also did a research fellowship at Brigham and Women's Hospital. And for those of you that aren't from Boston, combining these two places sometimes isn't the easiest thing to do, but it was really great because you do get to see different sides of people. So then what happened and how did I innovate? Well, I decided while I was a fellow that I would try to do a career that was based upon electrophysiology and epidemiology. And at that time, there really hadn't been many people who had done that. You know, Bob Meyerberg had sort of been studying epidemiology of sudden death, but really critically trained epidemiologists really weren't common in electrophysiology. So what I did and how it worked was that I really had a diverse group of mentors. And so the people on this slide, this group of people would sort of hang out together, but this group of people and this group of people over here would probably not be hanging out together. So I have electrophysiologists, epidemiologists, nutritionists, statisticians, and Dr. Fuster, who is the chief of cardiology when I was a cardiology fellowship. All of them supported me and supported this strange sort of track that I was going under. And this is something that I would recommend to younger fellows is to really, it's great to have a strong mentor, but to broaden, because I think you learn things and you learn different perspectives and new ideas when you have a number of different mentors. So then I took a faculty position at Harvard Medical School. And as Janet mentioned, I'm an electrophysiologist. And first I was at MGH and an epidemiologist at Brigham and Women's Hospital. And then I switched completely to Brigham and Women's Hospital. And I was at Harvard Medical School for 21 years. During that time, I shifted from doing about 40-60 clinical to about 20-80 as my grant support came in and I was successful in that arena. And I had a research program that I established on epidemiology, prediction, and prevention of sudden death. So, and I became a director of a center for arrhythmia prevention, which is really a research center without much of a clinical component, and had funding from NIH, AHA, and industry. And I finally rose to professor of medicine at Harvard Medical School in January of 2015. So this was the situation that I was in for about 21 years in Boston. And so what inspired innovation in myself and in my trainees during some of these early stages? And I think one of the things that that inspires innovation is doing something different. I think all of us kind of are identified by what we have established, and so developing a niche and not being afraid to do something that is different than perhaps what other people do. I love hearing a young person say, hey, I want to mix these two things. And, you know, nobody's done that before, but I will encourage that and say, go for it. So I think that that's really important. Also, as we've heard earlier, following your passion. If you really think you want to do something and it's a great idea, you know, do it. Persistence. Why is persistence associated with innovation? Because what's happening when you face adversity, you have to think of ways to get around it. And how do you do that? By innovating and trying to think, okay, that didn't work. Let me do this. Who hasn't in research submitted a grant multiple times, multiple ways, and eventually had some success. And you only do that by changing your approach and by being persistent. And then incorporate feedback. I think when you're younger, sometimes this is difficult. Feedback seems like it's completely negative, but it's not, but sometimes you have to keep going, don't incorporate it to the point where somebody tells you like you can't do what you want to do. You just keep going, but do pick up the positive feedback that you get. And remember, failure is part of the process. There's absolutely no way you will ever innovate, you'll ever do something chancy unless you are allowed to fail. And I've always said that for myself and also for my trainees. You really do have to allow that to happen. And when you hear no, think of it as meaning not now, or maybe it'll lead to a yes from somebody else. Because, we get told no all the time, and innovation is how we get around no. We think of another way, we use our resources. And collaboration is really important. Being able to really have ideas from others. Most of the best papers I've done have been, and ideas that I've had have been in a process of a group, having people with diverse expertise get together. You come up with ideas that you never would come up with. So I think, in your training and where you want to be, this is the reason to have diverse sponsors, to have diverse mentors, to have diverse collaborators. Having those social connections that you heard about earlier is really important. And then finally, really fostering your faculty and your staff to be creative, and not just faculty, but staff, because staff are often the people who lift you up. And so you can empower them, delegate, and also promote. And all of that is really important. Let them be the corresponding author. Let them have all the press. Let them, because really that's how they can get excited about research and then, want to do cool things themselves. And I've always found that some of the best ideas come from junior faculty. So then the other lesson that I think helped me to innovate and to succeed was just to expand a little outside of your own institution. I showed you those mentors from earlier, and I had many, many more over the course of my time at Brigham and Mass General. But I really made a lot of connections through really identifying myself as an electrophysiologist and networking. And so the Heart Rhythm Society was really important for my networking. And also I met so many people that I collaborate with through that organization. And then also AHA and ACC, again, speaking at meetings, if you ever, like Dipti said, if you get asked to do something, you say yes, so that you can be there and be out there and also hear what everybody else is doing. I miss meetings in person because you really would get that energy, and we still get it virtually, but it really, I can't wait till we can go back to that as well. And then also I did something called the Executive Leadership in Academic Medicine course, which I think was really helpful for me, where you get to work with a whole group of women leaders. And again, there you get to hear all kinds of different ideas, and you get to learn from others about ways that you could do things that might help you succeed or help your staff. And then also, if you aspire to leadership like I did, to give you a roadmap, because you heard what I did was I was primarily research, and I primarily ran a research group. So now, given what I've transitioned to do, I'm glad that I had that as well. So one of the things I was asked to talk about was my HRS journey. And so with my HRS journey, there was a lot of networking. As I said, again, presenting your work, give talks, attend meetings. For me, there's a lot of men, and Nora, who's on the call, has had a lot more men when she was there. And so you just have to realize it's okay. The first couple of meetings, you're like, okay, this is really, but I hope I encourage anyone who's a woman to go into electrophysiology, that most of our male colleagues are very, very supportive of us. When asked to do the work, you do it, like you heard from Dipti. And you do whatever it is. I mean, even reviewing an article for a paper can help somebody see how smart you are and see how intelligent you handle things. So you just don't know what it is that'll get you recognized. And follow your passion. I've always been trying to promote research in EP. Eventually, I was selected to be on the board of trustees, and how I was selected was because I was presenting my research, and the CEO came up to me and said, you'd be great on the board of trustees. So again, you never know when these opportunities are going to arise, and you take them. And then finally, I was selected to be on the presidential track, probably because of my performance on the board of trustees, and I got to be the program chair of HRS meeting. And then the next phase happened. I've been in Boston all these years. I lived in, loved Boston with the fall and all my Red Sox and Celtics and Patriots. And then I came here to Los Angeles, and this was my view before I came here. But again, it's been much better than that. This is much more like what it looks like here. And again, with all these teams that I didn't know, but you come here and you find out it's not such a big deal as it is in Boston. So why did I do this? I became the chair of cardiology at Cedars-Sinai Medical Center. And the reason that I decided to switch gears, and again, this was definitely innovative to a certain degree, is that, I really wanted to do something outside and broader than what I could do just in my research role. And so this was an incredible opportunity to run a department and with an amazing group of people. So I just had to jump at the chance, even though it meant leaving my family and everything that I knew. Establishing a new department has been a real exciting a challenge and has required a lot of innovation. And I have had to empower the staff to be innovative because they had to think differently. We're no longer a division. We are a department, and we have all kinds of responsibilities based upon that. The other thing that I realized we needed to do was recruit and promote our talented, diverse faculty. And we had a lot of stellar faculty, and what we're doing now is just really sort of adding and promoting those that are there as well, so that they can have as we heard from Carol, the right title. So we've been working very hard on that. Provide gasoline for the fire. That's an amazing, that's really something that I love doing. And that's one of the things that's great about Cedars, because Cedars really does like you to innovate and does support its people. So been able to really, really just set some people who are just completely on fire, continuing to burn. And collaboration is really important. Collaborating with the leaders that were already there. Noelle Berry-Mertz is on the call, and she's been a wonderful collaborator. But you learn through these people, and you learn all kinds of new ideas and new ways that you could approach problems. Transparency and fairness, I think, is incredibly important. And again, that makes you innovate in the sense that it allows everybody to know what's going on and what the playing field is. And so I think that helps to promote others to be innovative. And again, as I said, seeking out expertise, coaching can be helpful, when you start a big role like this. And again, just fostering your faculty and staff to be creative, reward and recognize, empower, delegate, and again, promote. And I've had the great opportunity to work alongside Joanna Chikwi, who's been the chair of cardiac surgery, and she came at the same time. So this has really been wonderful for women, and we get to have all these strange pictures taken of us together. But we really enjoy working together. So finally, just a minute on my presidency. I expected, as Deputy did, probably to be traveling by plane all over the world, and instead we're on Zoom. And so again, you have to innovate because now you are president and you're in the Zoom role. And when you think about the role of a society president, it really isn't like I get to decide what HRS does. I get to try to enact the strategic plan of HRS. And so initiatives span multiple years. One president doesn't necessarily change everything, but you can start things and finish things. And the number of things that we had to work on during my years was really reimagining our scientific sessions, trying to think about what are we going to do 5 years in the future, because this really has been our major source of revenue for the society. So it's very, very important, and also very, very important to its members. We had to totally pivot to digital reach and education. Digitally, as you heard about the coffee chats, and we had town halls, and trying to connect with members virtually when you used to be able to see them at meetings. I personally spurred several research initiatives that are now ongoing to look at registries and task force for that. And also we had formed a diversity task force to try to increase the diversity in our field and also address some of those issues. And we wanted to increase early career representation. It was very, the board of trustees is everybody's 50 or above probably. And so we want to try to get more younger people involved. And then we also started some collaborations with FDA and industry, and we outreach to patients through websites. So most of these things were all done virtually. So even though, it was reimbursed, and of course, there's always reimbursement issues, but we were able to try to connect that way. And finally, one of the things that was really special for me was we finally did have a meeting. It was a small meeting in Boston, but I got to recreate the handoff from Andrea Russo, who was the president before me. And, I've learned so much from her, and it was so great to follow. And as Dipti also has her woman who she's followed. And then I also got to give an award to one of the giants in our field, Doug Packer. I got to decide on that award. So that was really special for me. So even though it was a pandemic year, we got a lot accomplished, and it was very rewarding. And I hope that we've made some inroads on HRS. So thanks for your attention.
Wow, thank you so much, Dr. Albert, for sharing your journey, what you learned to succeed and how much you got accomplished during this pandemic. Such great pearls, really such amazing pearls from all of you, all of our speakers today. I really appreciate you joining us today. We're gonna go ahead and now move on to our question and answer period. I do see Dr. Jamal Rana, I think, still on there, but I'm gonna go ahead and oh, there we go. So I'm going to let Dr. Rana field the first question from our audience, because he's been taking a look at all of your responses. Go ahead. Thank you, Jamal.
Yes, so thank you, everyone. I've been in awe and learned a lot. And clearly, men in cardiology have to learn so much. And this has been fantastic session, a must watch for everyone. So we have a very engaged audience, and we'll just go down the list of the questions. And so the question one was that given the social, maybe Dipti can take it because she's been involved in so much innovating herself during this time of COVID and on social media and all. So the question is that social media has made our world of cardiology a lot smaller. Do you feel that social media is helping or hindering our opportunities for leadership?
I think it depends on how you use social media. I mean, I think that social media can certainly be a great platform to get a message out. So, for example, the chest pain guidelines were released today, so it was a great way to disperse that message or to advertise certain things, or like this conference. So from that standpoint, I feel that social media could be helpful. I think sometimes social media could sort of take a message and you could have runaway or negative messages that come out. I just think you have to be careful in the way that you interact with social media. I don't think that all content is okay for social media. So I think that there needs to be a certain amount of social media savviness that has to do it. So I think just being a little bit careful. And I'm sure that my colleagues that are here talking with share that with me. Christine, I saw Carol, you were.
Yeah, so I could not agree anymore. But we think it can actually be a really great thing for women in cardiology. So with Janet Hahn, we published a paper on the Twitter usage by women with hashtags specific to women in cardiology, et cetera, and found in general that the messages and support that that community gave was so much greater than the general Twitterverse, and that many of the tweets were used to promote other women, give them leadership opportunities, etc. So, but it's exactly as Dipti says, the devil's in the details. Make sure it's all uplifting and positive. And it's just like, it stays on the internet forever. So whatever you put out there, it has to be something you'll stand by.
Thank you so much. That was a great question. I'm going to field the next question. And Dr. Watson, you gave us clear mission of, pay us, see us, support us. I'm going to ask each of our members, including Jamal, actually, as a male representative and California ACC president, to just comment on how you yourself help drive this mission forward, in terms of fostering the future and addressing each of these issues that Dr. Watson outlined. So Dr. Watson, I'm going to let you start first.
Okay, yeah, so I believe it has to be a multi-level approach at every level. So at the individual level, again, you're writing a paper, grab a younger colleague and ask them to write it with you. You're going to a meeting, you see someone walk by, grab them and introduce them to your colleagues. So that on an individual level, that's something we all can do, but that's never enough. So it has to be then at a health system level. We have to try to get on committees and involved in the power structure, get a seat at that table where the decisions are made. And then of course, in the general population advocacy in Washington, and join the California ACC Political Action Committee and help get some of the legislation we need to see our profession thrive. So
thank you. Dr. Japuri?
Yeah, I think Carol made a lot of the points. I mean, I think, first of all, even just having this discussion is a huge step forward, right? Putting out the message as simply as, pay us, see us, support us. Because sometimes, I mean, at least when I was younger, we never even heard those messages, right? And then I think this idea of transparency is very important. I think we should be fostering and nurturing an environment which is transparent. So you can ask so why would you then settle for a job where you get paid $20,000 less if you're doing the same job? And I think that teaching everybody, I mean, there are books written about the fact that women always ask for less, but I think we have to teach them and say, no, you need to ask for fairness. But I think transparency goes along with it. I think professional societies can play a role by having these conversations, not only through women in cardiology sections, but really with our member colleagues, our male colleagues, governors, people in leadership positions, that this is an issue of, we're not just talking about diversity and inclusion. We don't want to just be included, but we also want to be paid fairly and included fairly. So I really think these types of conversations need to continue. Education. I would like to hope that we don't need to mandate these things. But only bad behaviors requires mandating, but hopefully we're professionals and we can kind of get the message out and we can help each other to get there.
Thank you, Dr. Eng.
I think the healthcare landscape is so rapidly changing right now, particularly with the Affordable Care Act. And we see a lot of health group and systems starting to try innovative things, right? And Kaiser Permanente, we have actually a really symbiotic relationship with the insurance arm and the medical delivery arm. And as part of the Permanente Medical Group, one of the things that really drew me to it was that we're a large group practice. So in our group right now, I sit on the TPMG board of directors on the compensation committee. And our philosophy for our thousands of physicians is that money isn't going to be the thing that brings you here. It's not going to be the thing that makes you leave. And we're market competitive, so we attract the best and the brightest. And we have parity between our males and females. And it really takes a systems level approach like that to be able to really get that equity. It's not just about an individual female negotiating her salary. You actually have to embed that into the systems of how you look, how you promote, and you do it very intentionally. And I'm very proud to say that even in our medical group right now, we're more than 50% women. Across all specialties, not just primary care. This is all across all specialties. And within our cardiology group, we're 50% women. So I've had 3 of my babies here. And each time when I went on maternity leave, my amazing colleagues stepped up and covered for me in the same way I stepped up and covered for them, so that we have that parity. And so there's so many practices and practice styles out there, and each of them do this in different ways. And by having these, I'm just in awe of the panelists here, because I think by having these women leaders in each of these different types of systems, that's where the change comes.
Thank you, Dr. Eng. And Dr. Albert, you've done this for our own department, but I'm going to let you describe how you pushed forward to achieve.
Yeah, I mean, I think that what everybody has said, I mean, just women have to get in power, you know, and then once you are in the leadership role, you have to exert that, and you have to, you know, like in HRS, you know, the program, we basically made it so that it was 20%, 25% women speakers when we have a field of 6% women. And how do you do that? You do that just by doing it. And believe me, sometimes there were eyes raised that, what? You're going to have this woman speak about AF ablation? Yes, we need a woman speaking about AF ablation. And then as far as, you know, the equity and the parity, like you're talking about, I mean, you just, it's amazing, you know, that what happens a lot of times is the squeaky wheel gets the grease, and that doesn't, and that doesn't always go across gender lines, to be honest. I've been surprised, you know, so I in my own role, I did an equity assessment and, you know, was able to sort of, at least on my own time, but I realized that that wasn't something that, you know, had been done over time. And unless you, like Rita said, embed it in your sort of process, and you think about when you give that raise to that one person, well, how does that affect all the other people that, you know, are doing good work and just didn't ask for it? So it's complicated, but I think having systems really is helpful.
Absolutely. And certainly, you know, having men support he for she is very important.
Absolutely.
So Dr. Rana, what would you say to this group of audience members?
Yeah, I think just looking around the Zoom room, all the giants here, I think the future is very good. For myself, I can speak that I'm the chief of cardiology section in our hospital, and 3 out of our last 4 hires were women, and 50% of cardiology is women, including 2 interventional cardiologists. So we try to do what we say, and it's not empty words. And you know, we round CCU, and we have a residency program, and I look around, and I feel more than my 50% of residents are females. So day to day, I feel the future is going to be bright. And thanks to all of you, your inspiration and your leadership, I think things going to keep moving forward.
Thank you. I have a question for Dr. Ajapuria, but we may ask other panelists to answer this. How do you organize the many priorities that demand your attention? If you, maybe each of you can also just describe like a simple way that you yourself organize your priorities, that would be great.
I think that having an assistant is really important because they can help organize your time and to see all your calendar. But I also think I look at my schedule quite often to sort of have an understanding of what's coming, what's tomorrow, what's a day, 2 days from now, what's happening next week, what's happening next month. And that is something that you have to do on a constant basis so you keep up with your schedule. I'm lucky in this role that not only do I have a personal assistant here, but ACC gives me so the 2 of them support, coordinate. And I literally get a schedule every morning that says what I have to do that day. And with all of my Zoom links that I don't have to go looking for. So that is really helpful. But I think the biggest thing is time, or, you know, management is by knowing what you have to do, you can keep one step ahead by preparing for that.
Thank you. Dr. Eng, I'm going to ask you the same question, but kind of through the lens of a mother of 3 as well, in addition to your, of course, chief responsibilities.
So, you know, I think priorities, it's hard to just name them off on my one hand, because at any one day, it's a little different. In the last 2 days, I've dealt with a hospital that had no power after PG&E cut the line on accident. Some of our COVID tents flying away during the rainstorm, so quickly being able to hammer that down and get things continuing to run so we could care for our patients, and just the overwhelming demand, and all my little ones at home. And so for me, I think it comes down to sort of what I was saying, that you can do everything. You often just can't do everything all at once, right? And having an incredible village around you that helps you, whether it be family or friends or amazing colleagues, and then giving yourself some grace that you're not always going to get it perfect. I make a ton of mistakes, and I have the humility to say when I've made a mistake, and the humility to raise my hand and say that I need help. And amazing friends and colleagues where I have the safety to say that aloud, and to model that for my team, who then can similarly do the same thing, so that we're in an environment where that people can speak up. And I think we as women continue and do that strongly, and we need to do it even more, just as all my predecessors helped me do. I remember when I thought about going into cardiology, that was my biggest concern. I was single. I didn't have any kids. I didn't have any time to date. I was so busy being on call every single night. And I remember sitting in Nora's office being like, oh, I wish I could be a cardiologist. And she was like, what are you talking about? Just do it. And so just like that, my future was changed, right? So that's our role, each and every one of us in each of our different capacities, whether it's a clinician, a researcher, an executive, whatever role of influence and power, use that and share that to help those around us.
Thank you so much. I do see a comment from Dr. Goldschlager says, make it happen and see it through. Very, very good point. Dr. Watson, we heard from you and several others about the imposter syndrome, and several of our audience members are curious, how do you overcome the imposter syndrome?
Okay. A, I don't think you ever overcome it, and B, I'm not sure you really want to. The imposter syndrome for me means always asking, did I do the best I could? Did I do the right thing? Is there anything I could have done differently or better? I don't want to ever lose that, and I don't think anyone should, but when it tips over into imposter syndrome is when you start realizing the answers to all of those things are, yeah, I did the best I could, I did everything right, but I'm still uncertain of my worth, and that's when it's a problem. So questioning yourself, never a problem. Not believing your worth, a lot of it is a problem. The thing I think that will help is forums like this, so we can all understand, and I can sit down with any of you and tell you my 5 most blatant mistakes and how I recovered from them, and then you will never feel like an imposter again, because you will never do things as dumb as I've done, right? So I think we all have to share our foibles and our mistakes honestly and support each other through it. Never a problem to ask the question, but it's always a problem to always, always, always not believe you belong.
Thank you. That's always a very good message for all of us to keep in mind at all stages of our life. I'm going to ask one final question for all of the audience, for all of our panelists. We're running out of time. So in just one very brief couple of words, I'm going to ask to each of you, if you were talking to another new leader, a new woman in cardiology leader, what would you advise as kind of your number one advice that maybe someone that you wish a prior person had told you? I will start with Dr. Albert.
Be easy on yourself. I think that's one of the things that we expect so much from ourselves, and you're going to fail a little, and it's okay. And you'll be surprised. More people will think you've done it better. It's a little like the imposter syndrome, but just take it a little bit easy on yourself every once in a while.
Thank you, Dr. Albert. Dr. Ichaporia?
It goes by really fast, so have fun and be joyous.
Very good. Thank you. Dr. Eng?
You are the right person at the right time to lead bravely and courageously.
Thank you, Dr. Eng. And finally, Dr. Watson.
I would say outsource everything that you can. I have 4 kids, and there's 0% chance I would have survived if I didn't outsource the things that don't matter. I don't have to make homemade cookies. I never have, and I never will.
Wow, thank you again so much to all of our fantastic panelists. You are just such role models for all of us. Thank you for such wonderful pearls of advice that we will carry through our careers. For all of you, this session has been recorded, so we will be posting it to the ACC website. Thank you again all, and have a wonderful evening. Take care, everyone.
Thank you so much.
All of you for listening.
Bye.